What is obstructive sleep apnea? Sleep apnea is an involuntary stoppage of breathing during sleep. Obstructive sleep apnea is a mechanical obstruction that causes a stoppage of breathing. Why is snoring and sleep apnea not easily recognized in women? Snoring and sleep apnea are generally considered to be conditions predominantly affecting men. The basis for this assumption is made purely on early epidemiological studies and clinical research conducted on male patients. Studies going back to the 1970s and 1980s suggest that the male to female ratio of sleep apnea was around 60 to 1. But now we know through more recent research that it has recognized that snoring and sleep apnea in women is not as rare as we thought at one time. More recent studies on general populations have reported male to female prevalence ratios for sleep apnea at around 2 to 1 for people aged 60 and up, and 7 to 1 for people in their 20s and 30s. But despite these findings, the greatest prevalence of snoring and sleep apnea in men still trends to promote an unintentional selection bias for referrals. Some studies have found that men are twice as likely to be referred for a sleep study than women. Many GPs rely on self-reporting snoring and sleep apnea, and because men are more likely to seek help about snoring from their GPs, they're more likely to receive an early referral for a sleep study. Nearly half of women who snore do not report their symptoms to their GPs, often due to embarrassment or social shame or stigma. But either way, they do tend to be heavier users of healthcare resources prior to a diagnosis being confirmed. Undiagnosed or misdiagnosed, which is the case. The few population studies that have included women show that undiagnosed sleep apnea is far more prevalent than misdiagnosed. One study found that sleep apnea was undiagnosed in more than 90% of women with moderate to severe sleep apnea. Unheard of. But one hypothesis has been put forward that because women often present with symptoms that differ from the current clinical indications for the evaluation of sleep apnea, the condition could be missed or misdiagnosed. For example, in one study, nearly half of the female patients did not report apneic events, choking, or restless sleep to their GPs, but all the males did. Snoring is a costly business. In fact, snoring and sleep apnea treatments will go into the $6 billion a year industry. A study comparing healthcare costs among patients with snoring and sleep apnea found both sexes incur nearly double the healthcare costs of normal patients. But women incur significantly more costs than men. And people with sleep apnea tend to use the medical services almost 3 to 1 over people without sleep apnea. Both sexes have considerably more consultations with specialists, and women have nearly 50% more visits compared to men. Similar figures have been found for drug costs, with women being prescribed antidepressant drugs 3 times more frequently than men. The results of the study concluded that snoring women tend to have more minor illnesses and atypical symptoms, while men with the same severity of snoring have more chronic or fatal diseases. The symptoms of snoring and sleep apnea have an adverse effect on neurological and psychological function, resulting in either poor work performance, difficulty in concentration, memory impairment, headaches, nausea, erectile dysfunction in men, impotence, and decreased libido in women as well as men. These symptoms have the same effect on both men and women. Same disease, different symptoms, different ways that the symptoms are shown up.